On trauma-informed care. Trauma-informed care shifts the focus from what's wrong with you to what happened to you. A trauma-informed approach to care acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation, past and present, in order to provide effective healthcare services with a healing orientation. Adopting trauma-involved practices can potentially improve patient engagement, treatment adherence, and health outcomes, as well as provider and staff wellness. It can also help reduce avoidable care excessive costs for both the healthcare and social services sectors. Trauma-informed care seeks to realize the widespread impact of trauma and understand paths of recovery, recognize the signs and symptoms of trauma in patients, families, and staff, integrate knowledge about trauma into policies, procedures, and practice, and actively avoid re-traumatization. A comprehensive approach to trauma-informed care must be adopted at both the clinical and organization levels. Too frequently, providers and health systems attempt to implement trauma-informed care at the clinical level without the proper supports necessary for broad organizational culture change. This can lead to uneven and often unsustainable shifts in day-to-day operations. This narrow clinical focus also fails to recognize how non-clinical staff, such as front desk workers and security personnel, often have significant interactions with patients and can be critical to ensuring that patients feel safe. Trauma-informed care 6 core principles. So the 6 core principles are safety, trustworthiness and transparency, peer support and mutual self-help, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So what are the principles of trauma-informed care? So following our organized approach to care that are necessary. So safety. Throughout the organization, patients and staff feel physically and psychologically safe. Trustworthiness and transparency. Decisions are made with transparency and with the goal of building and maintaining trust. Peer support. Individuals' shared experience are integrated into the organization and viewed as integral to service delivery. Collaboration. Power differences between staff and clients and among organizational staff are leveled to support shared decision-making. Empowerment. Patient and staff strengths are recognized, built on, and validated. This includes a belief in resilience and the ability to heal from trauma. Humility and responsiveness. Bias and stereotypes and historical trauma are recognized and addressed. What are the benefits of providing trauma-informed care? There are a number of benefits to using a trauma-informed approach, not only for patients but also for providers and staff. Many patients with trauma have difficulty maintaining healthy, open relationships with healthcare providers. For patients, trauma-informed care offers the opportunity to engage more fully in their healthcare, develop a trusting relationship with their provider, and improve long-term health outcomes. Trauma-informed care can also help reduce burnout among healthcare providers, potentially reducing staff turnover. What are the steps to becoming a trauma-informed organization? There are many ways to become a trauma-informed organization, and the process does not have to be a burden to adopt. Foundational steps organizations can take a move toward fully adopting a trauma-informed approach to care include building awareness and generating buy-in for a trauma-informed approach, supporting a culture of staff wellness, hiring a workforce that embodies the values of trauma-informed care, and creating a safe physical, social, and emotional environment. How to support someone who has experienced trauma. So give them space if they need it. I can't read all of these, but recalibration, perspective, predictability, attribution, reciprocity, support, and choice.